Hello, welcome to this lesson. In this lesson, we will briefly touch on the subject of salaries in Italy. During this presentation, we will delve into essential information regarding the incomes of healthcare workers in the context of Italy. Our focus will encompass three pivotal aspects: taxation, employment types, and categorization. We will explore how these elements interplay to shape the financial landscape for those working in the healthcare sector. Through this exploration, we aim to provide a comprehensive understanding of the remuneration structure for healthcare professionals and shed light on the intricacies that define their earnings within the Italian healthcare system. When healthcare professionals assume the role of public employees in Italy, they receive a consistent monthly salary that is intricately tied to the specifics of their employment contract, often governed by the National Collective Labor Agreement, NCLA. This agreement plays a pivotal role in determining the compensation structure for these professionals. The monthly salary varies according to the terms outlined in the NCLA, which takes into account factors such as the individual's role, experience, and qualifications within the healthcare sector. This approach ensures a fair and standardized remuneration system that respects the diverse contributions made by healthcare professionals and reflects their dedication to providing quality medical services across the country. The compensation structure for healthcare professionals in Italy is intricately linked to the specific type of employment contract they hold, often referred to as the National Collective Labor Agreement, NCLA. One such variant is the private healthcare sector NCLA, which outlines the terms and conditions of employment for professionals within private healthcare institutions. Italy's social healthcare educational sector encompasses a diverse range of more than 70 distinct NCLA types, exemplified by entities like Cooperative, UNEBE, Agidai, Anasti, Aris, IOP, IAS, ANFAS, and Don Gnocchi, among others. These NCLAs serve as crucial frameworks that define the salaries, benefits, and working conditions for healthcare professionals across various sectors of the industry, reflecting the country's commitment to ensuring fair and tailored remuneration practices within its dynamic healthcare landscape. For private sector, you can follow the link below. In November 2022, a new National Collective Labor Agreement, NCLA, for the public health sector in Italy was approved. This new arrangement introduces a new classification system for employees and consequently changes to the wage structures. Our current information materials will soon be updated to reflect these new changes. Within the realm of healthcare employment in Italy, various subtypes of the National Collective Labor Agreement, NCLA, exist, each catering to distinct segments of the industry. These encompass the public healthcare sector NCLA, which pertains to professionals operating within public health institutions. Another variant is the healthcare sector NCLA for health management, targeting professionals involved in the administrative aspects of healthcare organizations. Furthermore, there's the NCLA tailored specifically for specialist territorial district outpatient services, doctors, and other healthcare professionals, acknowledging the unique challenges and responsibilities they undertake. Lastly, the NCLA extends to encompass family doctors and local public institutions, acknowledging the pivotal role these professionals play in community healthcare. These diverse subtypes within the NCLA framework ensure that compensation, benefits, and working conditions align with the specific roles and responsibilities of healthcare professionals, fostering a comprehensive and equitable approach to remuneration within the Italian healthcare landscape. In Italy, nursing aides are referred to as operators. Within the area of operators, these individuals earn a gross annual salary of €20,105.34, which equals a monthly gross salary of €1,546.56. On the other hand, professionals like nurses, pediatric nurses, midwives, biomedical laboratory technicians, radiology technicians, neurophysiology technicians, and others fall under the category of health professionals and officials. In this category, the annual gross salary is €23,298.93, and the corresponding monthly gross salary is €1,792.22. You can find the complete list of professions in the upcoming slide. The full list health professionals and officials can be seen here. For foreign healthcare professionals considering migration and work in Italy, it's essential to understand the taxation framework that applies to their incomes. As they embark on their journey in the Italian healthcare sector, they will be subject to income tax based on their earnings. This tax system operates on a progressive scale, where different income brackets correspond to varying tax rates. For instance, for annual incomes up to €15,000, a tax rate of 23% will be applied. As their incomes grow, reaching €28,000, the tax rate adjusts to 25%. For those earning €50,000, the tax rate further increases to 35%. In the case of incomes surpassing €50,000, the highest tax bracket comes into play, with a rate of 43%. This structured approach ensures that taxation aligns with one's earning capacity while contributing to the overall funding of public services and welfare programs in Italy. It's imperative for these healthcare professionals to be well informed about these tax provisions as they manage their financial matters and plan for a successful and rewarding career in the Italian healthcare landscape. For foreign healthcare professionals considering migration and work in Italy, it's important to note that self-employed professionals often rely on payroll guidelines established by their respective professional associations. These guidelines serve as valuable references for determining the appropriate compensation for various types of medical interventions and services they provide. Adhering to these guidelines not only ensures fair remuneration for their expertise, but also contributes to the overall transparency and consistency of income within the healthcare sector. As foreign healthcare professionals navigate the intricacies of working in Italy, understanding and following these payroll guidelines can play a pivotal role in establishing a successful and financially rewarding practice.